For this project, I chose to cover endometriosis. I chose this disease in particular because several of the women in my family, myself included, suffer with this, and I wanted to bring some awareness and hopefully be able to answer some basic questions you have about this disease. Um, Roughly 10 to 15% of the female population are plagued by this disease, but in rare instances, like with breast cancer, there have been men that have been diagnosed. Endometriosis normally affects women of reproductive age, which is about 18 to 45, but it does not discriminate and can start as early as puberty and go as late as menopause or when your menses end. For those of you that are not familiar with what endometriosis entails, it involves the endometrial lining of the inside of your uterus, and it causes that lining to grow outside of your uterus or in other parts of your body. Your endometrial lining normally sheds each month in the form of a period and exits your body. Now, when this lining grows in other parts of your body and outside your uterus, it is not able to exit your body the way it normally would when you have your period. So it stays and it causes inflammation and irritation. The lining can also, almost like a plant, vine up and intertwine itself around your reproductive organs. And even in more severe cases, it can go to other parts of your body and cause further complications. As far as symptoms, it's really different for each individual. Some of the luckier individuals have very small to minimal symptoms, but the downside of that is it may go on for years and this disease could progress because most of those individuals don't even realize that there is something that's not normal going on inside their body. And when they finally do go and have a proper diagnosis, the disease has progressed further. And for those unlucky ones that are at the other end of the spectrum and have very severe and debilitating symptoms, it can really impact your daily life. As far as symptoms go, like I said, it's really just different for each individual, but they can include severe pelvic pain or chronic pelvic pain, bleeding and cramping between periods, heavy and more painful periods. It can cause pain during intercourse. It can also cause pain when urinating and defecating. It can cause nausea, bloating, fatigue, and even infertility. So for those individuals that do have a family history of this disease, it does raise the risk and the chances of you having it. As far as a diagnosis goes, there are many ways a doctor can help with the diagnosis, such as blood work to check your blood to see if you have the biogenetic markers for this disease, pelvic exams, ultrasounds, transvaginal ultrasounds. But the only way to have a 100% diagnosis of this disease is to have something called a laparoscopic inspection performed, which is what this entails is they go in through your belly button with very minimal incisions and they explore to see if they can find any implants or lesions on your reproductive organs or your uterus that are not supposed to be there. As far as treatment goes, there is no cure for this disease. But there are many treatments available depending on the unique individual's case and circumstances, but it also depends on what stage of the disease they are in as well. There are currently 4 stages. There is minimal, mild, moderate, and severe. So for the individuals that have more minimal and mild symptoms, to treat the symptoms, they can be told to take over-the-counter non-steroidal, non-inflammatory pain medication in combination with hormonal treatment, such as birth control. Now, for those that are plagued with this disease and are trying to conceive a child, that is not the best treatment. Normally, those individuals are told that they need a laparoscopy to go in and actually remove the endometrial implants and lesions to help you conceive naturally. For those that are on the more severe end of the stages for this disease, the most effective treatment to date and for those individuals is unfortunately to have a hysterectomy performed, which is when they remove most, if not all, of your reproductive organs. So you are no longer allowed to conceive, but you will not be plagued with this disease any longer.